You learned your blood type once in high school, probably got it wrong, and never thought about it again. But right now, hospitals across the country are desperately calling certain donors, while other blood types sit unused on shelves. Today, I'll explain blood type health risks and life-saving potential, like you're 5 years old. By the end, you'll understand whether your blood type is quietly raising your disease risk or turning you into walking emergency medicine. Your blood type isn't just a label doctors write on your medical chart. It's actively affecting your health right now. Your clotting risk, inflammation levels, even your survival odds for certain diseases. Type A blood is stickier than other types, which means higher risk of dangerous clots forming in your legs, lungs, or brain. Type B shows higher inflammation markers in study after study, the kind that leads to heart disease and autoimmune problems. AB is the rarest blood type on Earth, at only 4% of the population, which sounds cool until you need a transfusion match in an emergency. Type O people have cleaner blood flow and lower clot risk, but they bleed out faster when injured because their blood doesn't stick together as well. Your blood type is playing defense or offense with your health, and most people don't know which team they're on. Think of blood types like phone chargers you keep in your drawer. Type O is the universal USB that fits most devices. No extra attachments sticking out. Type A has one specific plug shape that only works with certain outlets. Type B has a completely different plug that won't fit anywhere else. AB has both plugs, making it the pickiest option in the drawer. Now here's where everyone gets confused, because their high school teacher got it wrong. The truth is, O positive is not the universal donor. O negative is. That minus sign matters more than you think because it changes everything. The negative means no Rh factor, no extra plug jamming where it doesn't belong. O negative blood is so compatible that hospitals pump it into anyone during emergencies without waiting for test results. It's the medical equivalent of that friend who gets along with everyone at the party. But your blood type doesn't just determine transfusion compatibility. It quietly influences your risk for heart attacks, strokes, stomach cancer, and even severe COVID outcomes. Type A individuals have roughly 20% higher risk of blood clots compared to Type O. That's enough to matter if you're on birth control, flying long distances, or sitting at a desk job 40 hours a week. Type B people show elevated inflammatory markers that correlate with higher rates of diabetes and heart disease over time. AB folks have increased stroke risk because their blood has characteristics of both A and B, creating a perfect storm of clotting factors. Type O people dodge these bullets, but get hit harder by ulcers and cholera because they lack protective antigens. Everyone got assigned a different character class in a video game, and nobody told you what abilities or weaknesses came with yours. Now here's where it gets interesting and valuable. If you're AB negative, your blood type is rare, but your plasma is liquid gold. Hospitals put special labels on AB plasma bags because anyone can receive it without rejection. Cancer patients need it to survive their treatments. Newborn babies in intensive care need it to make it through. Trauma victims need it when they arrive bleeding in the ER. James Harrison in Australia discovered he had rare antibodies in his blood back in 1954. He donated every single week for 60 years straight. His donations created a medicine that saved over 2.4 million babies from Rh disease. That's where a mother's immune system attacks her baby's blood during pregnancy. One person donating consistently for 60 years saved 2.4 million lives. Some people walk around completely unaware they're carrying the only thing standing between a patient and death. Pregnancy is where blood types go from interesting trivia to life or death stakes. If you're a woman with Rh negative blood and your partner is Rh positive, your baby might inherit that positive status. Your immune system might decide that Rh factor is a foreign invader and attack your baby's blood cells. In the early 1900s, this killed thousands of babies every year through miscarriages, stillbirths, and severe jaundice. Doctors watched babies die and couldn't explain why. Then we figured out the Rh connection and created a shot called RhoGAM that prevents your immune system from attacking. One injection during pregnancy, maybe another after delivery, and the problem disappears. Modern medicine turned a death sentence into a minor inconvenience, but only if you know your blood type before trying for kids. This matters because most people have no idea what their actual blood type is. They remember something from high school when the Red Cross came through, or they think they know because their mom mentioned it once. You're making health decisions in the dark without this information. If you're type A and take birth control, your already elevated clot risk just jumped higher. If you're type O and travel internationally, you're more vulnerable to certain infections that other blood types resist. If you're AB negative and never donated, you're sitting on a resource hospitals desperately need. It's like owning a fire extinguisher and never checking if it works until your kitchen is burning. But here's what you need to understand about these statistics. These health risks are correlations, not guarantees. Being type A doesn't mean you'll definitely get a blood clot. It means your baseline risk is slightly higher, and knowing that lets you make smarter choices. You can talk to your doctor about clot prevention if you're type A taking long flights or hormonal medications. You can focus harder on controlling inflammation through diet and exercise if you're type B with heart disease in your family. You can donate regularly if you're O negative or AB negative and literally save lives by sitting in a chair for 20 minutes. Knowledge turns random chance into smart decisions. Some blood types are so valuable that hospitals will call your phone during emergencies. O-negative donors get added to emergency contact lists because trauma patients need blood immediately. And O-negative works for everyone. One person commented about getting called directly to the hospital during surgery because supply was running low and they were the closest match. That's real life for people with rare blood types in small towns where inventory runs thin. It's like being on call for a job you didn't apply for, except the job is keeping strangers alive. Real people in the comments shared donation records that sound impossible. One person hit 163 donations over 25 years. Another donated for decades specifically to help babies with cancer. They knew their AB-negative plasma was one of the few things that could save those kids. Someone else survived clinical death and received transfusions that brought them back, and now they donate constantly to pay it forward. These aren't medical professionals. They're regular people who found out their blood type had value and decided to use it. Meanwhile, millions walk around with no idea whether they're carrying something life-saving or at elevated risk for preventable diseases. The system doesn't make discovering your blood type easy, though. Most people only learn their blood type by accident, during pregnancy, after a car accident, or when they randomly donate at work. Insurance doesn't cover routine blood typing without a medical reason. Schools stopped doing mass testing decades ago because of budget cuts. You're supposed to just know somehow, despite the fact that this information directly impacts your health risks. It's like the game assumes you read the instruction manual, but nobody handed you a copy. So here's the reality you need to understand. Type A blood is stickier, meaning higher clot and heart disease risk you can prepare for with your doctor. Type B carries inflammation markers worth monitoring if you want to avoid diabetes and heart problems long-term. AB is the rarest, with increased stroke risk, but universal plasma that saves cancer patients and newborns daily. Type O has cleaner blood flow and lower clot risk, but faster bleeding and higher vulnerability to certain infections. The Rh-negative factor matters enormously for pregnancy complications. Modern medicine solved it with one shot, but only if you know your status before conception. Some combinations turn you into walking emergency medicine that hospitals desperately need. James Harrison saved 2.4 million babies because he knew what his blood could do. You might be carrying something equally powerful without realizing it. Your blood type affects clotting risk, inflammation levels, disease risk, and survival odds beyond transfusion compatibility. Type A faces higher clot and heart disease risk that you can monitor. Type B shows elevated inflammation markers worth tracking long-term. AB blood is rare with increased stroke risk, but universal plasma critical for cancer patients and babies. O-negative is true universal donor status that hospitals keep on emergency speed dial. The Rh factor creates pregnancy complications that killed thousands before we developed prevention. Some blood types make you an irreplaceable life-saving resource, while others require monitoring specific health risks. Most people don't know their actual type because the system expects you to figure it out during a crisis. So what are you going to do? Keep walking around clueless about information that could save your life? Or will you finally get tested and discover if you're sitting on a superpower?